We are talking today to Mr. Albarah Elkhani, Senior Vice President, M42, and he is also actively involved in Abu Dhabi Biobank. Thank you very much, Mr. Albarah, for talking to Mediworld Middleast.
Thank you, pleasure to be here.
Can you give us a brief introduction about yourself before we start this conversation? And what is Abu Dhabi Biobank all about?
Sure. So my name is Albarah Elkhani. I'm the Senior Vice President for M42. M42 is a joining of forces of two titans within the industry, the historical Mubadala health assets like Cleveland Clinic Abu Dhabi, Imperial College London Diabetes Centre and others, and also G42 Healthcare. So we're bringing technology innovations directly to patient care, and one of the major enablers is Abu Dhabi Biobank. And what I mean by enabler is we want to ensure that we are representing our communities in the region, drug discoveries, oncology, specialized therapeutics, and precision medicine. And we need a sustainable biobank to ensure that we're collecting these biosamples as well as doing research leading into therapeutics.
How do you compare the Abu Dhabi Biobank with the biobanks or the leading biobanks globally?
So we're in a fortunate position that Abu Dhabi Biobank is really there to bring all of the ecosystem under one roof, integrating all of the data that's generated throughout the entire ecosystem, like the genomic data, also the clinical data set, linking it to the biorepository of the samples themselves. Most biobanks work within specific cohorts or specific disease groups. We're fortunate enough that we are integrated within the entire healthcare ecosystem. We have a very supportive regulator, the Department of Health, who's really putting the framework to make the success of the Abu Dhabi Biobank.
And what are the international standards, Al-Sahi, is Abu Dhabi Biobank adhering to in terms of sample collection, storage, and the data management?
Absolutely. So when it comes to international standards, Abu Dhabi Biobank is following all the international standards through AABB and ISO standards as well. But I think what's more important is the sovereignty of the data and the managing of the data sets. It's critical that we take that most extremely seriously. We were fortunate enough to be managing also the Emirati Genome Program, which is a 1 million whole genome sequencing program, and data security is of the essence when it comes to this program. So we have extensive experience in managing data and looking at international standards to ensure that data can be utilized in a proactive manner, but also in a safe manner.
And how are you collaborating with the leading biobanks? And what kind of partnerships, successful partnerships or joint research projects you are taking it forward?
One of our key drivers and innovations that we are developing what we call an innovation hub. And this innovation hub is allowing collaborators both in what we call wet lab and also the research element as well to come on the ground physically within Abu Dhabi Biobank, collaborate with us on the specimens to really drive innovation in the United Arab Emirates and the region. By us opening our doors to international collaboration, we feel that we will get the best benefit out of the resources that we have locally.
Data protection is a very big issue if you look at it. How does the Abu Dhabi Biobank ensure the security and privacy of the biological samples and the associated data? How do your data protection measures are compared with those of the top global biobanks?
So we're obviously very tightly governed by the regulation, the local regulation here. But what's also very important to remember is that you have to ensure that you consent, you have something called an informed consent with the participants who are donating their samples. So it's critical that the all informed consent, it's giving you the remit to work with those samples, and you inform the person who's donating that sample of the exact work that you'll be doing. So based on those simple premise of informed consenting, we're obviously very tightly managed and regulated with our local regulations here, but also with the international standards. If we want to work and collaborate with international pharmaceuticals and global partners, we have to meet all international standards as well. So it's paramount that we maintain the standards that we currently have. And it's also paramount that we inform our participants of how we will be utilizing this data to improve life and hopefully bring therapeutics to the local community.
And how is the Abu Dhabi Biobank funded, and what resources are allocated to ensure its continuous development and the competitiveness on a global scale?
We are a partnership between the Department of Health and M42 to develop the biobank. Our biggest aim and driver really is to bring sustainable solutions to the local market through international collaboration. So that's our focus on how we can, first of all, build an infrastructure and framework around biobanking, and also ensure that we have international collaboration to keep this as a sustainable solution moving forward.
Coming back to a very, very pertinent question, how are you going to raise public awareness and engage the local community to participate in biobanking? It's still a very new concept in the Middle East. And how are these efforts in comparison with public engagement strategies of other?
We always build off the successes we've had in the past. So the Emirati Genome Program, in my opinion, the success of the Emirati Genome Program was the outreach community awareness. For you to be able to sequence 65% of an entire population in 3 years doesn't require just infrastructure and scientific capabilities, but it requires us to integrate and really assimilate ourselves with the community. So we worked on multiple awareness campaigns. We are physically present in all healthcare providers, within government institutions, but we also have the support from the regulator to build more awareness within the community. So that sort of governmental support, as well as us being directly engaged with the communities, really allowed us to succeed in the Emirati Genome Program. Applying similar methods, we will do that with the biobank as well, and we're very confident that we will build that awareness within our community to make this a success.
What is your 3-year roadmap for the biobank going forward?
That's an excellent question. For us, really, is to establish the infrastructure, which is currently what we're doing now, the capabilities in the infrastructure, and also the regulatory framework to allow us to safely work within this type of domain. Our big focus initially would be cord blood banking services, so where we're collecting stem cells from the expecting mothers and the newborn child to allow us to create a cord blood bank to serve any clinical therapeutics approved by the regulators here. Our second focus will be a disease-focused collection, where we're looking at cancer as a primary focus for our collection for the pan-human side of the biobank.
Thank you very much for talking to us, and we wish you all the very best in your future endeavors.
Thank you so much for your time. Pleasure to be here. Thank you.